Ensure that your name appears how it appears on Fortis's rosters on the screen here. We still have about 45 seconds. Good evening. Good evening. So we have about 20 seconds before we officially start, but I'll go ahead and do our housekeeping. Again, good evening to everyone. Welcome to week 3. And so ensure that you place your name and campus in the chat. Make sure that your name on the screen appears how it appears on Fortis's roster, your first and your last name. Remember, you need to be on camera. You cannot be riding in a car, cannot be in a hospital. All those things that we talked about, you can't be in those, can't be at work. If you are, just need to log on off and send a communication. Remember, these sessions are recorded and they are viewed by the attendance administrators. So our exam is next week. And you all, I did place an announcement in the, look it now, in the announcement section about the practice exam. So you should have a practice exam for all of your courses. In the past, it's kind of been optional because usually if you would work through one of the practice exams, it was kind of a go for all your classes that you were enrolled, but it is a requirement that you complete the practice exam for each of your classes. I'm going to pull up the announcement here. The passwords are either Fortis01 or either Fortis02. Make sure that the device that you're going to use for the day of the exam to download the exam on, make sure you're using that device because ExamSoft, it checks the specifications and it makes sure everything is correct. So this is the message in the chat. The practice exam in ExamSoft, it is mandatory. Please complete it for each course. In the event, read this right here, in the event that you do not complete the practice exam for each course, there's a 10% deduction. So it doesn't take that long to complete it, but it's just to ensure that your equipment is correct, the specifications are there, and it decreases the time on exam day when you're trying to download the exam. If there are specifications that are incomplete or do not match ExamSoft, then you can get those things worked out before exam day. On exam day, if you wait until then, and if there are some specifications that don't match, then you're going to lose your focus and it's going to put you behind. And it just creates this whole thing for you. So just go ahead and work through those practice exams. It's just a matter of clicking through each one of them. Now, some people will have downloaded or uploaded or what do you call it? I think they sent an update out or something. That's going to be with your device. So if you're having problems, you need to go ahead and call ExamSoft so that can be worked through. Because if you can't work through it prior to that time, it will not let you download your exams. So ensure that you complete the practice exam for each of your courses. Passwords are Fortis01 or either Fortis02. All right, I think that was all that thing, Brian, the updates that was new for us. We did have one exam review on this past Sunday. That link is already there. Ensure that you review at a minimum the exam review links that are provided. Right now we only have one, but we should have a total of 4. And also make sure that you go back through each of your classroom recordings. All right. So let's get started here. And then think about, for those of you that are taking more than one class, just as a reminder, I think week 4 is exam 1 for all of your courses. So just be thinking about your time and what you need to revise and do differently so that you can get all the study time in, the review time in. But I think thereafter, they don't all fall the same. But for some reason, week 4 is that magic week where most of the exams are given. So be thinking about what that look is going to look like for you and what time you need to devote to the different topics here. All right, so we're going to start off. I'm going to send an activity. We're going to start off with a small group activity. I just sent it to your mailbox in Canvas. So let's see here. How many slides are on there? We're going to mix up. We're going to do small group, and then we're going to come back to whole group, reviewing the activity here. So log into your Canvas, and you're looking for an email that I just sent, and it says activity. And there are 12 slides, really just 11. Excuse me. So what we'll do is place you in small groups, and I want you to just discuss, talk through the slide, do jot noting. And if you have questions about what's there, have those questions ready when we come back to whole group. We will take our quiz tonight, but we need to go over this information. And then we'll move on with that. And then we'll finish up our content because exam 1 is next week. So that's our layout. So let me open up the breakout rooms, and I will circle around to the breakout rooms listening to you discuss. But we will discuss. I won't interfere with your discussion until we come back to whole group here. All right. So again, the activity is in your Canvas mail. It just says activity. There are 12 slides, but the first one is just a title slide. So you're going to go into your groups, discuss, jot note. If you have questions, have them ready when you return. And I am opening up the rooms. Let me make sure it's evenly distributed. Okay. Accept the invitation, and I'll see you all in just a few seconds. Hello, are you all able to see the activity that is placed in? Okay, I think we have everyone back. So you all were having a great conversation, but let's hear from everyone in whole group here. Let's see here. Slideshow from the current slide. Let's see what I need to do here. All right, so let's talk about, tell me about what are the levels of prevention? What is primary? What is secondary? Let me hear from you.
Primary would be like vaccinations, educate people, teaching about sample healthy eating, of safe sex, how to protect the skin on the sun, promote activity, physical activity, things like that. Primary.
So we are preventing things. Okay. So we're preventing something from happening. Chronic disease process and injury. Okay, good. I agree with that. All right. Secondary. What is secondary?
Secondary is like screening, testing, like mammograms, pap smears, colonoscopies, blood tests.
Okay. So we're trying to see if there is some type of injury, some type of disease, chronic disease process. If there's something, and fill in the blank with whatever that's something. We're trying to determine, detect, or see if it's there. And if it, pretty much, if you see the word, what word begins with the S, is secondary.
Screening.
Screening, yes.
Screening.
But all screening, exactly. So if you see that word, it's pretty much automatic. But if you don't, if you see someone, like you all mentioned, someone getting a blood test done to see if they have high cholesterol, if they're getting a blood pressure measurement done to see if they have hypertension, to see what that blood pressure is, that is also a test that's testing or screening for. All right, good. So what is tertiary?
Education. Tertiary is like I'm sorry. No, go ahead.
It includes education on a disease that's already diagnosed, so how to manage it.
Okay.
Treatment.
Treatment. Yeah.
Physical therapy.
Physical therapy, is that what you said? Okay. So primary is prevention. So we're preventing the problem before it ever occurs, whether that there's injury, sun exposure, cold exposure, any type of injury. Immunizations. If we get a flu shot, we're trying to prevent. If we get a COVID vaccine, we're trying to prevent. Secondary is screening. It's early detection for early intervention. So we're trying to see, we're little detectors. That's that little, was it Inspector Gadget? We're trying to determine if there's something there for early detection. So the earlier we catch things, and like you all mentioned, colonoscopies, they found out, they just lowered the age. I think I mentioned this last week, where the age was 50. They lowered the age a couple of years ago to 45 because they realized the evidence from research shows that early detection, they can prevent complications. And it's an attempt to reverse the course. Routine screening recommendations, like these mammograms. We're looking to see if there are any abnormalities in that breast tissue. Those blood pressure screenings and pap smears. Now, what if in this mammogram here, there was a breast abnormality found, whether or not it's breast cancer or some other breast abnormality. Now that mammogram turns into tertiary because it's part of managing that disease process. So tertiary is treatment, management of disease to reduce the symptoms to improve the quality of life. And so they're still trying to look to see if there is any other breast abnormality, to see if that abnormality has gone away, has healed, has it gotten better. And all of that is part of managing it. So tertiary can be medications. It can be a diet, the food. I talked to a lady today. She was recently diagnosed with diabetes, and she said she had no idea. Before going to bed, her snack was ice cream and Twix. And then she started having some issues with her vision. And so now she has eliminated all these high carbs, high sugar, high fat contents from her diet. So that is tertiary because now she has type 2 diabetes. And so checking that glucose, monitoring that glucose level. She wanted her A1C checked because she had made all of these changes. She had been walking and exercising. She changed her diet and she wanted to check that A1C. And of course, it had improved. And then weight loss for someone that has hypertension. That is tertiary treatment because they're doing these things to manage, to improve that quality of life. So when you're trying to determine whether or not which level it is, you can say, well, hey, is this preventing something? Or are we trying to screen to see? Or is this treatment to manage? So that can help you because I want to say the HESIs are big on these levels of prevention. So that's why we making sure we understand what they are. All right. Which level of prevention? What did you all say for this? Education on diabetes related foot care and self blood pressure measurements.
Tertiary.
Tertiary.
Exactly. They're tertiary because here the person has diabetes and hypertension. So they're tertiary. But we're telling them about it. So they already have something. This person has hypertension, and the other person has diabetes, even though it is not, even though it is not a medication, because we kind of think it has to be a medication to be tertiary, but no. All right, so here we go. Pesticide exposure. So these are some signs and symptoms if we're working in that clinic or the ER that our patient more than likely going to come in and complain of. Acute memory loss, difficulty concentrating. Think about that mental stat. These are mental status changes. The abdominal pain, GI. Usually going to have some type of GI. But then think about the eye and the throat irritation. More than likely, these persons did not have on their personal protective equipment for putting on those pesticides on those plants. And so as a result of that, all of their orifices were open. So those pesticides got into the patient in their eyes, their nose, and their mouth. And as a result of it being absorbed, these are the signs and symptoms that we see. And then this is long-term exposure, chronic exposure over time. And I forget the name of the what was the name of the weed killer? I think it was Parkinson's that they realized evidence was showing that it caused. I think it was some type of class action lawsuit or something. But they realized whatever was in there, people were not protected from it because you're just doing your lawn. You may or may not put on gloves, but they didn't have the proper equipment on to protect themselves from the chemicals that were in that pesticide. So these are some symptoms. So, but my question to you was, how would we know if the person was exposed to pesticides or sun exposure, if they came into our clinic, we were assessing them and they complained of these signs and symptoms? How would we know?
Ask what their job is.
Got it. You right on it. We will ask. We have to ask. Well, what are your working conditions? What do you do for work? And then you want to narrow it on down or do a focus question. So, okay, I know you work on, you do sessional work, but what do you do specifically? Do you put pesticides on, or do you put the pesticides in the machine for the others to use, or do you work in the office? So specifically, just ask the question. That's part of our head to toe assessment and gaining that information. And we want to ask that open-ended question so we can get as much information as we can. So what are those working environments? Do you have, if you're applying pesticides, what do you put on to protect yourself? Okay, well, did this day that you put on your protective equipment over the last couple of days? So the whole thing is we ask that question. Good. All right. So when migrants arrive at a farm to work, they may find that the housing is not available, or it may be available, but it's substandard. There may be mold, broken appliances. Because remember, people are not living in these housing quarters ongoingly. It may be just for 2 months out of a whole 12 months. And so sometimes the employers, they really don't, keep those things up. Some even live in their cars or tents because they're just there for that amount of time, like strawberries. And I can imagine how long strawberries are good once they actually, I don't want to say hatch out, but once they actually develop and they're on the limbs, not on the limbs, but on the plants to pick. How long do you have to pick those strawberries? They're real fragile fruit. So whoever's coming in to help the strawberry farmers, they may only be there for maybe a few days. So, staying in the car or a tent may be an option because once you do that, you're on your way back home for the rest of the year. So, but when housing is available, most of the time it's overcrowded, as many as 50 people living in one house. It is, and this is documented there. And so the conditions are crowded. So you all were supposed to discuss like the living conditions and all of that. And then also discuss a secondary intervention for these living conditions. What did you all come up with?
Our secondary intervention would be screening, just for the exposure to the climate and sanitation risks, and then any diseases that may develop from that.
Got it. That's great. You all did really good. So screening, whether or not it's a questionnaire or even giving that TB skin test, because we do know like tuberculosis is one of those that are easily spread with those close quarters because it's airborne. Stomach viruses, it only takes that one person to break that chain. And here we go. Everybody comes in and they have, upset stomach or GI issues. But how do we know? We're going to screen. And our screening can be in the form of a questionnaire or actually a test. Okay, good. Older housing exposes residents to lead. And I think I told you about this early on too. Prior to I can't remember the year, but lead was in paint. It was used, it was a good preservative, and it was used in everything, but they realized that it was harmful to the humans. So initially they actually drew blood They did a test to see what the person's lead level was. But now, since we know that and lead is no longer in paint, what they do now is in the form of a questionnaire. They do ask at those baby clinics and peds clinics, well, hey, they have this questionnaire that asks those specific questions. Do you live in a home that was built before? Do you have chip paint and things like that? So it starts off as a questionnaire. It depends on those answers. They may also go ahead and draw blood just to make sure that those lead levels are safe. But that's still secondary. Got it. So in the form of a questionnaire or a actual test. All right, here. So poverty leads to chronic stress, mental health issues, high rates of chronic illness, high infant morbidity, mortality, shorter life expectancies, and complex health problems. Complex health problems lead to high health care expenditures, which lead to like, okay, well, what do I do with the money that I do have? Do I pay these bills? Because if I don't, I don't think doctors turn people away, but they constantly ask you to make that payment. So what do? And then you want to, you want that best quality of life. So, do you take out a loan to pay for the hospital bills and the doctor's bills? But inability to pay for healthcare is real because it's really expensive. Lack of insurance or either not having enough insurance is a real issue, especially when you have those complex health problems. And then living in areas where healthcare is just not available. In the rural areas, things are just spread out. There are usually not specialists there. There are some places that don't even have, hospitals and 24-hour care in the event that someone needs 24-hour care. Being unable to afford to take off work to travel to that neighboring town. And so what do you think people are going to do? They're just going to forego and just say, hey, I'll be okay. Most people just will wait. So low paying jobs often do not provide the health insurance. And then if they do you pay for the health insurance or do you, take home your funds? So I'm sure I would take home my funds rather than having to pay that health insurance cost because of what I'm actually getting paid. Therefore, potentially decreasing the attendance to well visits. So those complex chronic diseases, they're not caught early. They're usually advanced, well advanced. So with knowing that, reading that slide, you have to answer these questions here. True or false? Do income, and the whole concept was income. How does income impact a person going to the doctor? How does income impact a person managing a disease process in the event that they have one? What does income, how does that impact? All
They
right,
don't
so
have the funds.
what'd you say? What was
They
the
don't
first
have
one?
the fund. They don't have the funds to give it.
Okay, so with that in mind, answer these questions here. Low income increases the risk of chronic illnesses.
True.
True.
Low income does not improve health outcomes.
True.
True.
Low income reduces attendance to wellness visits.
True.
True.
Okay, they were all true. And that income, is no play about it. It's real. You make a decision. Hey, do I go here or do I put gas in the car to continue to go to work? Do I go to the doctor's office or do I buy my next meal? And so income is real. It's a real factor. And so poverty, here we go. We're talking about poverty, income again. Poverty is defined by the federal government and the various state governments based on whatever their qualifications. And they have, for example, a family of 4 making this amount, then they may qualify for these resources. Those, though, that are just above that line still desperately need help, but no longer qualify. If you make $1 over, $2 over, you no longer qualify for these resources. So that puts a person in a vulnerable position and makes them vulnerable. So you were supposed to discuss vulnerability in health outcomes. So tell me what are some things that you all discussed about income, poverty, being vulnerable, and then those health outcomes. What did you all discuss?
Even being just above poverty causes the risk for not getting the help that they need, or if they do have health insurance, it's not able to cover the care that they need.
Exactly. If you make $1 over, I mean, okay, still, okay, I have to pay for this versus my food or keeping my lights on. So as a result of that, poor health outcomes compared to those living above the poverty line. You usually have those poor health outcomes because they're just above. Is not, but however much more, that disqualifies me for these resources. So yet and still, am I going to these extra $10? Yeah, I'm above the poverty line, but this extra money that I have, am I going to pay for this doctor's visit, or am I going to put the next meal on my family's table? So as a result of that, I'm not going to that doctor's visit. So my health outcomes are poor. Increased vulnerability. I'm more vulnerable due to those fewer community resources. I'm just more vulnerable because I don't have these resources to help me to offset or to stand in the gap so that I can get that health care that I need. And then increased vulnerability due to lack of employer provider insurance. Employers can offer the insurance, but then it's really expensive. If you don't have work for one that gives you that discounted rate, insurance is really expensive. So that in itself increases my vulnerability as well. But a lot of times is not even offered. They have someone to come in, but then you're paying for it. They just have someone to come in to subscribe you to it. But the employer itself isn't paying any part of it. So that increases my vulnerability due to the lack of the employer provided insurance. So we got 3 things here. Poor health outcomes, because I'm just above the poverty line. I'm making $10 more, even $100 more. It's still not that much to stand in the gap of all of these resources. So I'm not going to go get those well visits because I have to probably more than likely pay out of pocket because I don't have this insurance. My employer does not provide it for me, and it's expensive. So the extra money I do have, I'm not going to use it. So that in itself increases my vulnerability. Are we clear on these 3 health outcomes here, you all? It increases your vulnerability because you have those fewer resources available. You no longer qualify for the Medicaid, the WIC, the food stamps, and all the other resources. Like there was this program, I was in the elevator the other day. Young lady had, she had a bag of diapers and she had a bag of, I don't know what the other thing was, but I was like, okay. I made a little joke about all of our bags. We all have these different bags. And she was a nurse, and the program that her task was, it was a program that lasted for 2 years for new moms. So I was like, oh, well, I know some new moms. But the thing was, if you had already had your child, whether it been one day, because I knew a young lady, her baby's 10 days old. I knew another young lady, her baby is getting ready to be 4 months old. They didn't qualify for this program. And it sounds like a beautiful program, but they're just above the date of delivery. So they no longer qualify for this person. She says, they did home visits. They provided so many supplies for you. And it seemed like a great program. But those people that had already delivered 10 days, their child is 10 days old, they no longer qualify. So that's another example of how living just above that federal poverty line, $100 more, you just don't qualify for these resources. So, and I said that to say too that, once you become a nurse, there are all different areas out there, settings that you can work in. Because I didn't even know about that program, but it was really, really nice. They followed them for 2 years with providing the education, the counseling, like that one-on-one. Beautiful program. All right, so here we go. Young children are at the highest risk for effects of poverty. Why? Because they solely rely on someone else, whether or not that's a parent or a guardian. So, and as a result of the poverty, they're at risk for not having adequate nutrition. What does that lead to? It's like a domino effect. Then there you go, brain development. They have high exposures to environmental toxins, trauma, abuse, and then just have a lower quality of daily care. They have more chronic diseases, more nutritional deficits. Because think about it, right here, we're saying these poverty is below the level, the recommended amount. So then there are going to be some things that are going to be lacking, and it could be food, fresh fruits and vegetables, and it's like a domino effect. So teens living in poverty are more likely to have below average academic skills and are 3 times more likely to drop out of school. This is all evidence information. They have higher rates of teen pregnancies and are more likely to suffer complications with those pregnancies because of the lack of prenatal care. And as a result of the lack of prenatal care, there might be low weight babies, premature babies, and even birth defects. And there is an increased risk of unintended pregnancy as well in teens that are living in poverty. There's an increased risk of unintended pregnancy. Okay. Homelessness are those without permanent housing. And includes if someone is actually spending the night, at a relative home, they're in a shelter temporarily. So homelessness is someone without permanent housing. Sometimes, even if it's intermittent, but being homeless, it makes you vulnerable. It exposes you to elements, people that you might not normally hang around, living conditions. For example, shelters, they can get crowded. There might not be meals available. So it makes you vulnerable for malnutrition, lack of sleep. You're in this place with all these people that you don't know. So you can't even get your proper sleep. There's high incidence of substance abuse, serious mental illnesses. Some may experience tuberculosis as well, because we talk about those crowded living conditions. And they also may be victims of crime and also skin infestations and chronic illnesses. Trauma is a major cause of death and disability, such as gunshot wounds, stab wounds, head trauma, suicide attempts, and fractures. The life expectancy, and this is all data that's evidence-based, of someone that's consistently homeless is 44, as opposed to someone living to 78 years of age, just because you're exposed to all these different stressors. You're not getting your sleep is very important, not getting your nutrition. So that it almost half the lifespan, because if you're living in if you're homeless for a long time, it puts you at risk for decrease not so good health outcomes. Any questions on that? Any questions on the content we just covered? So let me just do some questions real quick, just to make sure we all right. We have about 30 seconds, so you can come on back on camera. We'll finish showing up. So make sure that you have your ID, you have your 2 devices. You will have to be at that side view. Ensure that you've downloaded the exam prior to coming. And you have your dry erase board. All right, here, let's move on with our content. Okay, public health nurses. And I have the question on one slide, so I'm just giving you a time to kind of pause and think about it. I'm gonna go on and make sure I cover the content. So public health nursing focuses on, what would you say focus? Public health nursing focuses on. It focuses on preventative, not curative services. That main issue, their foundation is to prevent something from happening altogether. Evaluating the prevalence of chronic diseases provides direct insight into the community's health needs. So we're that community nurse and we're trying to come up with a program. So we need to know, well, what diseases already exist? What is what is the rates of it? What is the prevalence of it? How many people have it? So that helps guide what that community needs. But public health nursing focuses on preventative services. And we do need to evaluate the prevalence, the number, how many people of whatever that disease process is that's living in that community. That's part of identifying what that community needs. We can go in with all these different programs and things, but if it's not what that community needs, then it's just an intervention that we have. And the community might be non-compliant because they're saying, well, hey, we need this, but you're bringing in something that we don't need. So we do want to evaluate what their need is. So just think about the different body systems, the respiratory particularly. What are those organs? What does our respiratory system do for us? It allows that gas exchange. It cleans out that waste, that carbon dioxide, and it moves oxygen in, goes throughout the body. So what happens when someone has asthma? Those airways, they are smaller, they're constricted. And as a result of them being smaller or constricted, that air has a hard time moving in and out. So we do want to help people or call their attention to identifying triggers. What's triggering these asthma attacks? And that in itself, if we identify well, it's, when I go and spend the night at, my grandmother's house, and I sleep in that room that has, all the carpets and the drapes. And that's where all my favorite stuffed animals are at. Those things could be those triggers. So that person will keep a journal and they'll write down and identify, what's going on, where are they at, what are they doing when they're having those asthma attacks. So, because we do want them to, at a minimum, avoid pet dander, mold, and smoking. Even if a parent says, well, hey, I'm no longer smoking those traditional cigarettes, but they're smoking, they're vaping, then that's still much of the same. We want them to avoid, all of those different irritants. Stuffed animals, they're not desirable because stuffed animals, drapes, and carpets, they kind of, the little dust particles, they're like dust collectors. So now they have like mattress covers, they have pillow covers, all these things that are made of these special products that help lessens the chance of someone being triggered to having the asthma attack. And also they can use HEPA filters, inside of the room. And they're HEPA filter vacuum bags as well. And it gets all of those extra dust particles and everything out of the atmosphere. But a child should not be excluded or told not to participate in physical activity if physical activity or extraneous exercise triggers that asthma attack. So what happens is once they identify that is a trigger, more than likely that healthcare provider is going to prescribe that child a medication that they will take prior to that physical activity. And that will lessen and altogether, decrease the chances of a child having an asthma attack just because they're, playing running track or playing football or baseball. So there's that pre-treatment with that short-acting inhaler is usually what they do. Once they've identified that that's an irritant or a trigger for a child, but we don't, make them not participate. Smoking has been proven harmful effects on children. Children with respiratory disorders, like we just talking about this asthma, they have a greater risk from complications from that secondhand smoke. We want to create that smoke-free environment of whatever, vaping or whatever it actually is. We want to reduce the amount of smoking, and then we may have to come up with or present or offer a smoking cessation program. There are a bunch of them out there for the parent or guardian. So here's that picture of that spacer that we talked about last week. This spacer increases the medication delivery. This spacer, this is the inhaler part, and this plastic tube, it increases the amount of medication that child actually gets. Because if they place that inhaler in their mouth, they might not have their lips positioned just so they may lose medication. But attaching that inhaler, it does assist in that child getting all of the medication. So we do want to encourage our children to get up and move, and adults as well. So I was thinking here, the weather's getting to be permitting, so we got to get back up and moving. We got to decrease that screen time. Obesity is the greatest risk health is the greatest health risk to children that requires community health nurses to provide education about treating and preventing obesity. But the whole thing is getting that child up and moving, getting those healthy food choices and options offered to them. We want them to stay away from those 100% fruit juices because they're empty calories. They're empty calories. We ask parents to not to use food as a reward or punishment for their, to teach their child a lesson. We want them to pay attention to like their hunger cues and also get them on a schedule. But we don't want to use food as a reward or punishment. Avoid those 100% fruit juices. They are empty calories. Well, what can we do to prevent the spread of infections at home and elsewhere? And of course, you see in the picture, washing those hands. Gotta wash those hands. Wash your hands often. We want to routinely clean surfaces at home and, in the different settings, healthcare settings. We want to separate. Do not cross-contaminate one food with the other. So that we want to use separate cutting boards for meats and fresh fruits. And then we want to store those things separately as well if we place them in the refrigerator. We do want to promote cooking foods at proper temperatures. And then washing those hands. Before and after. What should you do? Wash your hands before and after preparing food, before handling animals or their food. Do we want to just clean the counters and cutting boards once a week? No, we want to clean them more often after each use. This was an activity that I had, but I'll go ahead and talk us through it. We want to thaw frozen foods in the refrigerator, not on the countertops. We don't want to thaw out foods on the countertops. We want to place them in the refrigerator to unthaw. We do not want to use the same cutting board for meats and fresh produce. We want to use separate cutting boards and clean them. Okay? So the roles of the school nurse. You will wear many, many different hats. Of course, you're there for the children, but you will be called up on to provide lunch and learns to provide the education for that day, the PTO meetings, the PTA or PTO parent teacher organization, the parent teacher meetings that they have. They'll call you in, but you do want to keep in mind that developmental delays will impact academic progress more severely. So someone that has developmental delays, so they have what they call individualized education plans. They're like care plans, but they're education plans. So we want to help the teachers and parents identify resources or interventions that will offer their child, in order to do their best. But keep in mind, developmental delays, it does impact academic progress. So we do want to identify those interventions and things that we can do, such as maybe take their exams or quizzes in a quiet setting, extend time, provide those accommodations. Okay. So you're considered as that safe place. That's that school nurse, you're considered the safe place. So they'll come to you and tell you more things than you ever wanted to know, but because you're that safe person. Keep in mind that families play an integral role in the well-being and development of their children. So our initial interactions with the families and their children, we want to go ahead and establish those therapeutic relationships, that rapport with them, have that effective communication. And also be sensitive and know that what we just talked about, that income, socioeconomic and cultural backgrounds. We need to know about that because with the social economics, we can go ahead and identify some resources because schools have collaborations and partnerships with different organizations. And so if the child wants to participate in, I don't know, track or band or something, and there are some fees and there's an issue with social economics and or income, then we can identify those resources for that parent, and that it's up to them to pursue it, but that can help so their child can still participate in whatever activity that it is. Okay. Let me go back. I think it's going the wrong way. Nope, it's going the correct way. All right, you make the difference as a school nurse here. So you are that safe place, your office or wherever they have you stationed at. Students will seek assistance from you, of course, for injuries and illnesses. You'll do routine medication administrations. You may even do procedures, but they'll often seek you out for reassurance. Students who experience bullying or abuse may report physiological symptoms. They'll keep coming to you with a stomach ache or earache, their knee hurts. You'll do your due diligence and everything will be within normal limits. And so you do want to ask those more focused, open-ended questions just to ensure that this child is not being bullied or being abused. So we do want to ask about events that lead up to those physical symptoms. Well, tell me what's going on before your stomach starts hurting. Tell me what's going on before, I notice this time of day you come to the office. Well, what's going on before? So the whole concept is the school nurse should assess the circumstances that lead up to the physical symptoms that they're telling us about. We've checked them out and everything is fine, but they keep coming back. So we want to ask those open-ended questions and ask about the incidents or activities that lead up to that time so that we can identify if something else is going on. So, like I said, so you'll treat scrapes, cuts. You might even have to call the ambulance. They may have to airlift some children. It's your game for anything to happen in that setting because they're running, jumping, and hopping. During cold months, you want to provide that cold exposure prevention information. During the hot months, you want to encourage them to decrease the heat exposure, to stay well hydrated, and they will call on you for everything. And then if there's something going on with the eyes, we do apply a warm compress, not a cold compress. So what happens during when we're trying to screen a child for scoliosis? What is that procedure? We have that child to bend forward at the waist, and we're looking for that even shoulders. Here, they're uneven. They're bending over, and you see one shoulder is higher than the other. That's abnormal. And then you will see that X curvature in the spine as well. But you ask that child to bend forward at the waist, and then you're looking for asymmetry, whether or not there's symmetry or asymmetry. So there's also scoliosis called functional. This is not the traditional scoliosis where you have that S curvature in the spine. It is due to poor posture. It is not a spinal disease. You remember your grandmother saying, hey, sit up straight, stop slouching. And so, yes, they were onto something. They knew what they were talking about. Functional scoliosis is usually caused by poor posture. It is not a spinal disease. So sit up straight. Okay. I am going to pause here and answer any questions that you have. Healthy People 2030, one of their main goals is focusing on gun safety. It is a priority that we know where those guns are stored. In addition to that, we do want to provide, as parents about going to those gun safety classes, we do need to know where the ammunition is stored, but it is priority that we know where the firearm itself is actually stored. We talked about the levels of prevention: primary, secondary, and tertiary. Okay, we're preventing something from happening before it ever occurs. Okay, secondary, we're screening. Is aimed at detecting whether or not there's a disease early. Is there an injury? We need to find out early. Okay, by asking parents and guardians or caregivers of the patient, how are they coping? The nurse identifies problems early so that interventions can be implemented for improvement. Okay, secondary prevention activities involve screening activities. whether or not we're screening for hypertension when we're doing that blood pressure measurement, that mammogram. And secondary can be in the form of a questionnaire. Secondary prevention, screening to identify diseases in the earliest stages before the onset of signs and symptoms. And how do we do that? We ask questions. We have questionnaires. There may be lab tests. There might be imaging. Tertiary, it includes those interventions aimed at disability limitations and rehabilitation from a disease or injury or disability. So we are trying to manage, preserve, increase that quality of life with those tertiary levels. Okay. All right, here we go. Which level? Counseling about non-pharmacologic management of chronic back pain or back pain. Tertiary. Screening for hepatitis A or screening for tuberculosis. We're asking questions about signs and symptoms. Secondary. Educating about minimizing pesticide exposure. Primary. Screening mammogram, a mammography. Secondary. Mammography after the breast abnormality. And then we're using that to manage, to identify, so that's tertiary. Regular blood pressure screening, so blood pressure measurement, that's secondary. Educating a patient or a family member on diabetes foot care. Tertiary, they have diabetes. Okay. Secondary prevention helps detect, identify early detection. So we were going to discuss colonoscopy screenings, cholesterol level monitoring, and mammograms. And we're going to discuss another secondary prevention to detect breast abnormalities. So another secondary intervention to detect breast abnormalities. We know we have mammograms, but you can also teach or perform those self-breast exams. That's another intervention that someone can be screening to see if there are any breast abnormalities. Cholesterol level monitoring, drawing that blood to see what that cholesterol level is, to see what that hemoglobin hematocrit is. All of that is screening. Colonoscopy screenings, they detect early colon cancer. Primary prevention strategy, it aims to prevent the disease before it actually happens. So immunization clinics, we're giving vaccines to prevent whatever disease process. We're providing that nutritional education to promote healthy eating. Smoking cessation programs, we are providing information about preventing smoking or stopping smoking, cessations to stop smoking, so that cigarettes or that nicotine or those things that they're exposed to does not cause a chronic disease. So a smoking cessation program, stop smoking, is primary prevention. Okay. Aims to prevent onset of diseases related to smoking. The nutritional education helps individuals make healthy choices to prevent disease. And of course, the immunizations prevent the disease that's specific to that immunization. Okay. We're screening caregivers about how they're doing and suggesting coping strategies. Secondary. Okay. This just is a review over the different levels of prevention. Okay. Are pesticides harmful to humans? Pesticides are potentially toxic to humans. Remember, they're killing pests. And then if we're not protected from those pesticides, we can experience acute side effects or chronic. Those long chronic health effects of being exposed to pesticides for a long time can actually lead to cancer. So pesticides can get inside of your body from eating, drinking, and breathing them in and by skin contact. So what signs and symptoms would we actually see? That skin irritation, that nasty throat irritation, a cough, eye irritation. So we want to encourage them to wear that protective equipment, whatever it is they need on to protect themselves, their bodies from ingestion and also absorption of those pesticides. So we ask about their pesticide exposure. That would be a top priority. Okay, characteristics of rural life. They, in general, a rural area or a countryside is a geographic area that is located outside of towns and cities. Usually, rural areas have a low population and have small settlements. Things are spaced out. Look at the pictures here. You see all these homes, these buildings. In the rural areas, you have all the nice space. There's more space, greater distances between the people that live in those communities and services. They usually have to travel over to neighboring towns just to see specialists and also just to get that if they need to go to the hospital. There are a lot of rural towns that don't have hospitals in them. And there are a lot of the hospitals in rural towns that are closing down. And so what do? They have to travel to that neighboring town. Okay. Complex chronic conditions are often cumulative response to multiple long-term stressors from infectious agents to lifestyle strains. We address the full range of those stressors and approach the body as an interconnected system. Complex chronic conditions defined as diabetes plus there are many more such as coronary artery disease, congestive heart failure. Those are some examples. The community and school nurse are preparing for a lunch and learn program about lead poisoning prevention. What information should be discussed? Okay. Lead poisoning occurs when lead builds up in the body over months or years. Even the smallest amount is harmful to the human body. Children younger than 6 are especially vulnerable to lead poisoning. Think about it. They're running, jumping, hopping, they're falling down, they put things in their mouths, and that in itself can lead to developmental delays. Very high levels can be poisoning and can be fatal. Lead-based paint and lead-contaminated dust in older buildings are common sources of lead poisoning in children. The treatment for lead poisoning, there is treatment for lead poisoning. I forget the name of the process it is, but taking some simple precautions to help protect you and the family from lead exposure before the harm is done. If someone lives in older homes, then we want to ask and make sure that paint that's in there is not lead-based paint. The primary source of lead is paint from old deteriorating buildings. And we need them to avoid those buildings or get that paint taken care of, removed. Lead exposure can have serious consequences for the health of children. Lead exposure attacks the brain, the central nervous system. It can cause coma, convulsions, and even death. Remember that primary source of lead paint is from those old deteriorating buildings. So children who survive severe lead poisoning may be left with intellectual disabilities and behavior disorders. The World Health Organization guidelines are consistent with the Healthy People 2030. They have 3 overall determinants of health. And so they look at the physical environment, the person's individual characteristics and behaviors, and then that social and economic environment. Okay. Income and social status. The underinsured, the uninsured. The greatest impact on the child's overall health is that financial stability of that family. Because remember, that child is going to solely rely on that parent or guardian because they are a child. Children from low-income families have an increased risk of disease and injuries. Decreased finances, not having enough finances, or low income does impact the family's ability to access preventative health care. Because if I don't subscribe to insurance and I don't have the money to pay for that doctor's visit, more than likely I'm not going to that doctor's office to get those preventative tests or visits. Education. Low education is linked with poor health, more stress, and low self-confidence. What about that physical environment? Think about, do we have safe water? How is the air? Is it clean? Are there pollutants in the air? Are they healthy workplaces? Are the homes safe? The community safe? Are there sidewalks, playgrounds? What are the working conditions at the job? All of these things contribute to health. Okay, social support networks. These are your family, your friends. So consider this as you are trying to determine who's most vulnerable. If someone does not have that social support network, then they are more vulnerable. Genetics, they play a part. What health services are available? Men and women suffer from different types of diseases at different ages. Who is at most risk for adverse effects? Okay, here we have 4 people. And the question is, who is at most risk for adverse effects? Okay. That person that's living in that low income housing development. This person has a support system. This person has graduated from a community college. So their income might not be low. And a person has a support system. So these two have support systems. So it's between this person that has just graduated, a person that's living in that low income housing development. That low income housing development is going to be more, that person is going to be more at risk. Okay. Depression is a mood disorder. It does affect how a person feels, thinks, and handle those day-to-day tasks. Okay. We want to establish those therapeutic relationships, that rapport, show that we have a genuine interest in their well-being. We want to teach those coping habits. We want to reduce gaps in the continuum of mental health services. We talked about the rural areas, but here we're talking about migrant farm workers. What should we as a nurse consider for migrant farm workers and their families? Migrant farm workers usually do not have access to the usual resources that are available, because remember, they're just coming to that area for that amount of time. So they might not even be from that state. Many migrant farm workers do not have access to vehicles. They're just coming to that area to get the job done and go back home. So they might not even bring their vehicle. And then there might be a language barrier. The inability to speak English, if they're in an area where English is the primary language, that will become a barrier. It's for them getting the adequate health care. Remember the work sites, usually housing is not available. If it is, it's most of the time is in poor conditions. What are some health problems a person might encounter if their living conditions are crowded and there is in poor condition? That person's increased risk for tuberculosis, stomach virus, hepatitis, skin infections. Not having enough income or low income does affect someone's health. There are many causes of poverty. Who is at the highest risk? Remember those persons that are 18 and younger. An adolescent living in poverty, they're at higher risk for dropping out of school. Children are at the highest risk for the effects of poverty. It directly affects their nutrition, their brain development, their environmental exposures, and just their low quality of day-to-day care. So experiencing homelessness means not having stable, safe, and adequate housing. So a veteran that has post-traumatic syndrome disorder and that does not have a support system, they're more at risk than someone that has a support system. If someone lives in this group home setting, that's a support system. Homelessness is correlated. There is a correlation or relationship between homelessness and poor health outcomes. Okay. Creating those trusting environments and establishing those therapeutic relationships. We also must consider a person's culture so that we can provide that culturally competent care. We want to treat our clients and our families respectful in a non-discriminatory way. So we need to be sensitive to factors that are related to socioeconomic and their cultural backgrounds. What are the effects of healthcare outcomes for vulnerable populations? Many times you have to have an address when you're filling out applications for resources. So that in itself, a permanent address, so that in itself decreases or reduces a person for being even eligible for assistance programs. There are higher incidents of acute and chronic diseases. They most of the time, don't even know about the options that are available. And usually they seek healthcare in the emergency departments. And they're at higher risk for physical trauma and abuse. So our vulnerable populations, such as homelessness, people that are underinsured, uninsured, or living in poverty, usually they will get their health care in the emergency room. One of the Healthy People 2030 goals is to reduce firearm-related deaths. We need to know, it's priority that we know the nurse find out where the firearms are stored. You do want the firearms and the ammunition stored in different places. We can encourage firearm safety classes, but it's important, most priority, to identify where those firearms are stored. Healthy People 2030 aims to improve health literacy by making health information more accessible and easier to understand for the general public. It's not that I don't want to take care of myself, but I just don't understand the information that you gave me so that I can take care of myself. So in order to assist with improving health literacy, we're making sure Healthy People 2030 make sure that health information, those handouts and things that we give people, are easily accessible, and also that they're in that person's primary language so they can understand what they're reading. Another goal of Healthy People 2030 is to increase the proportion of people with health insurance to increase or improve the access to healthcare services. We talked about the children are at an increased risk. They're at most risk for experiencing poverty because a person is 18 and younger, they solely rely on someone else providing for them.